Hi, it's Christina with the Sisyphean Journal. Today is May 28th, and although the anniversary today is not of an abortion death, it's of an abortion clinic death, and there is a very important lesson in it for anybody who is trying to help women dealing with a complication with their pregnancy. Operation Rescue obtained documents from a 2011 medical malpractice and wrongful death lawsuit, followed by the family of a young woman named Rebecca. Rebecca had serious health problems from a condition which can lead to the formation of blood clots, deep vein thrombosis, and miscarriage or stillbirth. Now, when Rebecca went in for her 20-week ultrasound, she learned that her unborn baby had died. Likely, judging from fetal size, her baby had died at least 2 weeks earlier. So here this young woman is dealing with this tragedy. Rather than refer her for proper care in a hospital, her doctor referred this high-risk patient to a substandard abortion clinic. Washington Surgery Center is operated by Dr. Cesare Santangelo. Now, Rebecca went to the abortion facility on May 19th of 2010 for the first stage of her procedure. Now, Santangelo lacked hospital privileges, so he could not perform the procedure himself in a properly equipped hospital. And he did not refer Rebecca to somebody who could perform the procedure in a properly equipped hospital. And Rebecca's family noted that he did not inform her properly of the significant risks due to her condition, medications he had been taking, and the length of time between the day her unborn baby had died and the day that the procedure was being done. Instead, Santangelo inserted dilators into Rebecca's cervix and told her to return the next day for the procedure. Now, when she returned the following day, Santangelo told her she was not yet sufficiently dilated. So he took out the old dilators, put in some new ones, and told Rebecca to return the next day. But just 2 hours after being sent home, Rebecca returned reporting an abdominal pain. Now, Santangelo was not at the clinic at that time, so Rebecca waited. So at about 2:38 p.m., he began performing the procedure to dismember and remove Rebecca's unborn baby. By 2:45, her oxygen levels had dropped and she turned blue. Now, staff intubated her and administered medications. They kept trying to revive this extremely high-risk patient at the clinic until 2:58 p.m. So that's 13 minutes that they spent 13 minutes of precious time where she should have been in a hospital with competent medical care and all of the equipment and medications necessary, and they kept her on site before they finally called an ambulance. When EMS workers arrived, they found Rebecca to be bluish purple in color. Now, they began resuscitation efforts, which did improve her color. Her pupils again became responsive to light. At 3:12 p.m., they were able to detect a pulse. At 3:25, they transported her to George Washington University Hospital. She was diagnosed with massive uterine bleeding caused by disseminated intravascular disseminated intravascular coagulopathy, or DIC. And that's a condition in which the clotting factors in the blood aren't working properly. And remember, she already had a condition that placed her at high risk for clotting problems. So patients with this disorder can bleed out from even minor internal injuries. And because of this, doctors at the hospital weren't able to control the bleeding, and they pronounced Rebecca dead on May 28th. The autopsy revealed that fetal debris had gotten into her bloodstream, which can trigger DIC. And due to her disorder, like I said, Rebecca was more vulnerable to hemorrhage than a healthy patient would have been. Now, Rebecca's family sued the doctor and the clinic for $80 million, and the case was dismissed, but probably because the parties settled out of court. And for some reason, Rebecca's family decided not to file suit against the doctor who, instead of arranging for his patient to have competent care in a fully equipped hospital, sent her to an abortion clinic that's really only prepared to deal with healthy women and healthy fetuses.